My name is Faina Shtern. I'm grateful to Representative Giannino for the opportunity to present this prostate cancer awareness event. AdMeTech Foundation is a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. Dr. Sean Wason described recent advances in patient care. The main topic of my presentation is our prostate cancer equity program and its mission to bring these cutting-edge advances in screening, diagnosis, and treatment to Massachusetts men and eliminate health disparities. Prostate cancer equity program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research, and clinical care equity. We are grateful to Representative Giannino and other members of the Suffolk County delegation to the State House for serving as champions of our program. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2013 in collaboration with multiple organizations and has 4 components: public awareness, community education, prostate cancer equity and clinical care, medical education, and research. Our public awareness campaign, community education and outreach, is focused on the most vulnerable and underserved individuals. Since January 2023, we reached over 15,000 underprivileged individuals. This is a 50% increase compared to what we reported last year. Since 2019, our public awareness and education program reached over 52,000 people. For public awareness and education, our messaging is centered on the importance of screening and early detection critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. The center of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 7th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Last September, we had over 300 physicians participating during this event. After the event, our media partners published over 60 scientific presentations and reached over 35,000 physicians across the globe. It's difficult to find any corner of the world that has not been reached by this event. Our summit showed that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now, with so many novel diagnostics and therapeutic approaches, ensuring high-quality, personalized, precision patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care to all. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older can participate. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We strongly believe that our prostate cancer equity program, integrated with our large-scale public awareness campaign, has been placing Massachusetts in a strong position to become the first state in our country to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of their families and friends. This process consists of three components. One, AdMeTech Foundation's team members collect basic information and match individual patients' needs with the appropriate state experts for clinical care. Two, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, any insurance, and financial assistance if needed. Three, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as testing or treatment. I'd like to share with you a few recent examples of how Prostate Cancer Equity Program has been making a difference. This is a case of a Black man with a history of prostate cancer who is currently being treated. On May 15, his doctor informed him that his scheduled treatment could not be provided due to problems with the insurance coverage. He got upset and shared his situation with Representative Bud Williams and a leader of the Men of Color Health Awareness Program, MOCA, our community partner in Springfield, who referred him to us. On the late afternoon of May 26, right before the Memorial Weekend, he contacted us and appealed for help. Our primary goal was to restore his treatment as soon as possible, and we immediately reached out to Dr. Mitchell Sokolov and his team at UMass and secured their support. On May 30th, right after Memorial Day, UMass Urology provided guidance to this man how to address his insurance. By Friday the same week, on June 2nd, the insurance issue has been resolved, and the appointment with Dr. Sokolov was scheduled at the earliest opportunity in early July to resume his treatment. The following Monday, on June 5, a MOCA leader heard about what happened and asked for a second opinion for his own urologic health issue, and received an appointment with a leading urologic expert within a few days of his request. This is a story of a Black man in his mid-50s who was referred to us in mid-May by Cambridge NACP. This man was recently diagnosed with prostate cancer. He got alarmed when his urologist informed him that the best care will not be available to him due to his limited insurance. We connected him right away with the patient navigator at the Mass General Brigham. She obtained a referral from his primary care physician and secured approval from his insurance. 3 weeks later, by June 6, this man saw Dr. Adam Feldman, a leading clinical expert and one of our featured physicians. Dr. Feldman described various treatment options, but recommended curative surgery, which was performed in mid-August. We asked a few men to share their experience with prostate cancer equity program. The first video you will see in a few minutes was provided by Jose Javier of Lawrence, Massachusetts. And the second video features Ken Reeves, President, Cambridge NAACP, and prostate cancer survivor.
My name is Jose Javier. First, let me begin by thanking Dr. Shtern for inviting me here today and being part of this. I'm excited to share with you and grateful to be able to share with you for a few minutes a little bit about my story and my experience with AdMeTech in the organization. I met Dr. Shtern around the fall of 2015. I heard about her from a friend of mine at church, Victor McCain, which I'm grateful for because he was going through the same thing. And he was able to share at church, and I heard his testimony, and I was able to approach him after the service, and we had a great conversation. I was very shy about this subject. I too had a very high count of my PSA exam and had to go in for a biopsy. And I learned from Victor McCain the difference between an MRI biopsy, a guided biopsy, and also what is referred to as a blind biopsy. And those made a difference in my life. And I was able to meet Dr. Shtern through this process. And I was able to go and get a MRI guided biopsy at the NIH and so forth. And it was a fantastic experience for me. So for me, part of the takeaway when it comes to this is really to be aware. Be aware, learn about the processes, learn what's available out there, what programs are available for you, what are the best tools to do the job. A very important thing is to share it. That's what I learned from my friend Victor, is to share it at church, share it with other people so they can learn as well. And because in our community, especially in the Black American community and the Latino community, it's a subject that is not often spoke about. When we talk about our private parts and speaking about the prostate, it's not always a conversation that is too welcoming in our community. So I would encourage people to share it, to learn. And as Governor Baker always says, get tested. You know, it's easy to get tested. Ask your doctor for a test and be aware and that there are solutions out there. We have great referrals, we have great doctors, and contact the leadership, the people at AdMeTech, and they're able to guide you in the right direction. Thank you. Please allow me to say a few words in Spanish. Para nuestra comunidad en español, este tema de cáncer en la próstata es un tema súper serio, muy serio, y es un tema que nos impacta a nuestra comunidad significantemente. Yo le quería decir a ustedes que, por favor, hablen con su médico si sienten algún síntoma, si están teniendo problemas orinando, cualquier irregularidades. Hablen con su médico, no tengan miedo de conversar con su médico, hablen con personas que tienen experiencias similares y eso le puede salvar su vida. Lo más importante es hacerse un examen PSA. Por favor, estudienlo bien y aprendan más. Gracias.
My name is Kenneth Reeves. I am the president of the Cambridge branch of the NAACP, as well as the former mayor of the city of Cambridge, Massachusetts. My intention is to say a word about the AdMeTech Foundation and its offerings and benefits, particularly to communities of color and particularly to Black men facing issues with respect to prostate cancer. I would say that in Cambridge, we've been in the Men of Color Health business for more than 25 years. And so we have a Men of Color Health outreach. However, I think we've become much more knowledgeable about ways in which we can assist the men of our city. And we particularly have become much more knowledgeable about prostate cancer and its impact on particularly Black men, who are 5 times as likely to be affected by prostate cancer than white men. So that being the case, and I've dealt with prostate cancer theoretically, and then 4 years ago, I was diagnosed with prostate cancer. So I have my own journey. And after diagnosis, I was able to hear what my treatment options were. And I chose something called CyberKnife, which is a 6-day treatment where you go every day for about an hour. There is a laser approach to the cancer. And after that, I was able to be clear for almost 2 years. And then suddenly my PSA, or prostate specific antigen number, kept going up, and no one could figure out why. And I had many MRIs and other tests. And that's when I met AdMeTech, because I was describing this to a friend, and they said, "It sounds like you're lost in the maze of, what to do when your numbers are inexplicable." So I was in touch with our Dr. Shtern, and basically I had to tell her there is a test that they don't have in Boston that I need to have. It's an imaging test. It's very advanced. It's in Europe, but not yet approved by the FDA. And she said, "I'll get it for you." And she was able to arrange it through Sloan Kettering in New York. So after much red tape and bureaucracy, I was able to get that imaging test, and it did find where the prostate cancer had moved to an area around my lung, which my doctor, who's a very important, famous department head at Dana-Farber, said he had only seen one case in his career, so he was pretty sure it wasn't to the lung. So I then learned that, the physicians are great, but they're not God. So I called him and said, "Guess what? I'm number 2. And after being number 2, I still have had to have these various questions that I don't feel competent to answer about what next steps should be in my medical care. So while I have a wonderful team at Dana-Farber, who Dr. Shtern led me to, but even in all that wonderfulness, there are questions that I don't feel competent to answer. So she just 2 days ago helped me to answer 2 great big questions. So I think this is timely for you to hear that. In my big questions were whether I should participate in a particular study, which would, I'm now on a very expensive pill that has my PSA number at 00000. So this is $16,000 a month. And the question asked of me by my doctor is would I would participate in a trial which would essentially stop this pill, let the cancer come back, and then observe what that does with respect to the testosterone level. And the doctor also said, well, we don't get many Black men in trials, so we'd like to get it would be important if you were to say yes. And so this was hanging over my head like a cloud. I couldn't decide because I want to do whatever I can do that will be helpful to both science and to prostate cancer with respect to Black men, because self-interest is a wonderful motivator. Her immediate reaction was, "Not for you, because you had one of only 2 cases with your particular doctor. The experience with people like you for such a trial is too small. And so you should be very thankful to the doctor, but it's not for you." Thank God for having a foundation that's devoted to navigating men of color through the maze of prostate cancer to be able, with a scientific point of view, give that kind of direction and consultation. So I must say that is great. I also got to talk to her about a second thing, had to do with neuropathy. And so I went to a neuropathy doctor who was the head of neuropathy at the Brigham and at Dana-Farber. I got a clean bill of health, meaning that whatever neuropathy I have is appropriate for my age and for my diabetic status. But then Dr. Shtern introduced the issue of vascular. The neuropathy is basically your hands and feet. The vascular is the veins in your legs going down to feet. She suggested, well, maybe you want to see a vascular person too to get the fullest picture of what's going on with the circulation. Trust me, I have a lot of education and a lot of good exposures, but I think what AdMeTech is offering is the possibility to get the best advice for the best care possible at this time. And I want all men of color in Massachusetts to have that. So I couldn't recommend this program more highly based on my own personal experience and those people who I can recommend. This is my story and my song, but I must say that I have been very much helped by the advice and direction and management of AdMeTech.
Emma Couillard serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Greg McClay, a patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, and other clinical partners to expedite medical visits and address any needs you may have. Our team may not be able to right every social wrong that cannot be resolved by federal or state government, or provide perfect solutions for every man. And yet, we are committed to doing our best and making sure men are not left behind or struggling alone. If you have any questions about our program or need assistance, please contact Emma by phone, 617-523-3535, or by email, coordinator@admetechfoundation.org. Thank you for your attention.